North Texas police officers and even federal agents want parents to pay very close attention. What your kids could think to be harmless could end up killing them. Our Andrea Lucia explaining the sudden rise tonight in certain types of drug overdoses.
The warning from Fort Worth police is bleak. The city and surrounding areas have witnessed an alarming number of overdose deaths involving fentanyl, disguised as prescription oxycodone pills.
These are small, round blue pills that are stamped with an M and a 30 on them that represent oxycodone, and they're actually loaded and laced with fentanyl.
In 2019, 27-year-old Tyler Skaggs, a starting pitcher for the Los Angeles Angels, was found dead in a South Lake hotel, along with pills investigators say were laced with fentanyl. And just this month, in two separate cases in the city of Venus, two 16-year-old boys died after police suspect they overdosed on fentanyl.
We're seeing them as young as 13 that have overdosed from this on up to into their 30s and 40s.
In each of the cases in Venus, witnesses told police the boys thought they were taking oxycodone pills.
These people are not intending to overdose. They just didn't realize what they're taking.
Special agent in charge of the DEA's Dallas field office, Eduardo Chavez, says drug traffickers have become experts at producing counterfeit prescription pills.
Get the right color right, the stamps, to have it, perfectly stamped as if it came from a legitimate pharmaceutical manufacturer, so good that you put them side by side and you can't tell the difference.
The CDC has warned about the rise in fentanyl overdoses nationwide, and over the last 10 years, the National Institute on Drug Abuse has tracked a surge in fatal overdoses from synthetic opioids, primarily fentanyl, which now surpass those caused by heroin, cocaine, or meth.
Fentanyl's a very bad deal. Fentanyl's 50 to 100 times more stronger than morphine, and there's a real fine line between what can be therapeutic and what can be fatal.
The DEA says we need to let go of stereotypes we might have about what drug users look like or act like. They say often it is not as obvious as television or the movies might depict. A lot of the times it is kids getting drawn into this. They look at these pills and they think they look safe, like something a doctor might have prescribed them at some point, when in reality, they are extremely dangerous. Andrea Lucia, CBS 11 News.